Speaking about acute cardiovascular care in special environmental circumstances, I would like to show you some data and some our experience, unfortunately, from several last years from COVID-19 pandemic, earthquake, extreme water condition and air pollution, and important sporting events. Speaking about natural disasters, they're increasing in the number of them, especially hydrometeorological, but also biological and geological in the last 120 years, in last two centuries. Some of the reason for that is also global heating that we are dealing with in these two last centuries, and especially in last decades. Speaking about COVID-19 infection and COVID-19 pandemic, as I already showed yesterday, there was some trends in declining of the number of patients who were hospitalized because of acute coronary syndrome and who were treated with primary PCI all over the world, and the same was true for the elective program. The main reason from that was the fear of patients to be infected in hospital, and was the number 2 to 3% of our primary PCI patients are COVID positive, according to Japan data from the first wave. And because of that, lots of countries, including our here in Croatia, you will see, they perform lots of international cardiac organizations perform this algorithm how to diagnose and how to treat those patients in the time of pandemic, especially if they are COVID positive and infected with this disease. Of course, this decline in therapy, in recommended therapy, leads to some complication, higher number of out-hospital cardiac arrests, higher number of cardiac cardiac shock and of mechanical complications and worse reaction on especially out-hospital cardiac arrest. So the percentage of patients who died in hospital was higher, and hospital survivor lower among this group of patients in pandemic time than it was the case before it. Speaking about earthquakes, unfortunately we had in 2020 two relatively strong earthquakes in our countries. These photos are from the city of Zagreb and city of Petrinja, where those two earthquakes was. So the earthquake, according mostly by Japan data, because they have frequently catastrophic earthquakes. So according to their data, in that time of earthquake, number of patients with acute myocardial infarction and with sudden cardiac death rise after such a disaster. And same is true for urban area, but also for rural area. Same is true for acute coronary syndrome, but also for cranial hemorrhage. And the same is true for fatal and non-fatal myocardial infarction. If you are looking, if you see this investigation in tsunami, in tsunami area, there was a lower percentage of PCI, urgent PCI, and in surrounding area there was no difference. This was the reason for increasing of the mortality rate and standard mortality ratio in that region stricken with the tsunami. Health medical service in time of earthquake could be also even better than when we are not or before the earthquake. Some of reason for that, for if you are looking, for example, in this in these graphs, then these some reperfusion times are the same or even better after the earthquake. The reason for that is that emergency medical system are on a higher level in that time, and then normally, and some of these data are even better after the earthquake. In Croatian primary PCI that I spoke yesterday also about, we in the beginning of the 2020, when we saw that pandemic come in Croatia, we start first meetings about organization of our job on the department hospital, but also on inter-hospital level. One of our big Zagreb hospital was became in that time COVID-19 hospital for COVID-19 patients. So all patients from this hospital, including cardiovascular patients, are allocated in other hospitals in Zagreb. So then in that time we have lots of our medical staff infected with COVID-19 infection, or isolated, or in so-called self-isolation, because they were in contact with someone. We interrupted in the very beginning almost so elective PCI program. We have help from smaller PCI centers from Croatian PCI network, which were normally not inside this network, but they help us. They gave us help in that, especially for non-STEMI patients. And very early, we also performed this algorithm how to manage, how to treat patients with COVID-19 infection, or who are isolated or self-isolated. We had several webinars at that time on that with that subject, so we communicate even more than normally, and trying to organize our work in these special circumstances. And then on the end of the March, same year, we had this earthquake in Zagreb. It was 6 point something degrees of Richter, and we have lots of destroyed one also cath lab in our hospital, and lots of departments were also destroyed at that time, so we should organize ourselves. That day, that was Sunday morning, we in the I don't know hour or two, the lots of our colleagues were in their departments in hospital, and so how was the damage and how to manage with patients. Patients should be replaced from the hospital out, because our hospital where we are working is more than 170-year-old. So the buildings are very old, and they are strongly destroyed. But other hospitals in Zagreb take our patients for several days. And specifically was that in same time was pandemic, so we should think about these measures, pandemic measures, so very challenging. However, after that earthquake in Zagreb, we have a second, third, and fourth wave of COVID-19 pandemic, where the most challenging was the fact that our medical staff, nurses and doctors, were allocated in COVID-19 departments and COVID-19 hospital, and we had less people, less colleagues to cooperate with, to work on everyday Croatian people. But to be honest, at that time the number of patients was also smaller. There was a lower number of patients in that time. And on the end of December 2020, we had this earthquake in this county. It's 50 kilometers south from Zagreb. The epicenter was in the city of Petrinja, and this is Sisak Hospital, one county hospital, important with many patients, who's also old and was totally destroyed, internal medicine department. So we organize in several hours. We organize the transfer of these patients first in our hospital, because they are our referral hospital, and after that we other Zagreb hospitals took the patients and take care about patients from this county who should be hospitalized. So in that situation, you should also be organized in ours. This slide I showed you yesterday, the number of PCI, primary PCI in STEMI and also in non-STEMI decline according to this pandemic-19 and first, second and third wave. And in total we have a decline up to 15% of the normal number of patients, what is something less than is described by other authors outside. From outside, they were up to 40% of primary PCI was in some countries a lower number than usually. Earthquake, we performed this investigation, it's still in press, and what we found, if we investigated 5 hospitals in the circle of 50 kilometers around epicenter of the earthquake, and in that when we invested all of this hospital, there only a more non-anginal chest discomfort among patients after earthquake in several days after earthquake. However, when we investigated 20 kilometers from epicenter of earthquake, and these earthquakes were around 6 and 6 something Richter grade, so then we found statistically more younger men with risk profile who had more, statistically significantly more myocardial infarction, more arrhythmias which need cardioversion, hypertensive reaction, and interestingly the number of heart failure was statistically lower than before that earthquake. We investigated both earthquakes. Extreme weather condition and air pollution, it is known today from several investigations that they influence cardiovascular health, and what's usually situation is that the lower is temperature, the higher is number of hospitalization for acute myocardial infarction. Humidity had this S-curve, speaking about hospitalization for the acute myocardial infarction. However, there is also this biometeorological approach where author says that the discomfort of 9 or more hours daily because of high temperature could lead also to higher number of myocardial infarctions. We also investigated in our hospital influence of meteorological parameters and air pollution on the number of visits in the emergency department in our hospital, and what we found is that the lower was temperature, the higher was relative humidity, air pressure, concentration of nitric oxide and ozone, the higher was a number of patients hospitalized because of cardiovascular events. And normally in our emergency room in total, the higher number of patients are in spring, but if we are looking at patients with cardiovascular compliances and cardiovascular disease, then the highest number is during autumn and winter. Fact that air pollution is a trigger for cardiovascular events is well known that in patients with higher cardiovascular risk profile, this higher air pollution can lead to the higher number of myocardial infarction. What we have learned in our hospital is that higher humidity as well as higher concentration of nitric oxide can lead to higher number of cardiac arrhythmias, as well as higher concentration of ozone can lead to the higher number of ischemic stroke. And on the end, important sporting events. Important sporting events are acute emotional stress on public level, on a national level, using different pathophysiologic pathways and nodal points. And it is known, for example, from this investigation of performed in Germany on 2006 World Cup in soccer, where they found that after national team game there was a peak of the hospitalization and of patients with cardiovascular events. That was true for the STEMI, for non-STEMI, for cardiac arrhythmias, as well as for other all cardiovascular events. Statistically significant more such events than in such in time without the games. In 1996 European Football Championship in the Netherlands, they found that mortality from coronary heart disease and stroke was increasing in men on the day of the match. And we performed also in our country, in our hospital, such investigation. It was published last year. This was published this year, and we looked the incidence of cardiovascular events around World Cup in football in Russia in 2011, and we compared number of visits and hospitalization with 2017 and 2019 in same days. So what we found in our investigation is that incidence of cardiovascular admissions because of cardiovascular events was higher on the 3 days after games. We performed that on more than 2,000 patients, and higher incidence what we found was in women. What is interesting, and arrhythmias and angina pectoris are the most reason for such a situation. In conclusion, I will tell that more cardiovascular events could be expected in special environmental conditions. Health professionals should be prepared to work with a higher number of patients in such a situation. They should be prepared to some degree of improvisation, of course, but the operation of health system in such events, in such environmental circumstances, is the best indicator of its functionality. Thank you very much.